with a bit more explanation around how the vaccine exactly works, not being either it works or it doesn't, but about effectiveness, about how effective it is in stopping transmission and giving someone immunity. And we'll hear what that means in relation to the COVID strain that we know now has been imported from Brazil. And also about the effectiveness of the so-called managed isolation, where people who are arriving in the country are told to isolate in a hotel while it becomes apparent or not whether they have any disease. Absolutely, and if someone was flying in from Brazil today, for example, they would, whether they went into any part of the UK, even though Scotland it requires a bit more of an extensive managed isolation system, they would be going into managed isolation, i.e. hotel quarantine. But there have been health experts who have suggested, because of the way and because of the date of the positive test results of this Brazil variant, it does appear that these individuals came into the country before that managed isolation, that hotel quarantine was enforced, but of course would have been expected and obliged to quarantine at home. But we can hear now from the Health Secretary.
Good afternoon, and thank you for joining us once again. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 386. That represents 4.5% of the total number of tests and takes the total number of confirmed tests in Scotland to 202,470. 123 of those new cases were in Greater Glasgow and Clyde, 70 in Lothian and 51 in Lanarkshire. The remaining cases were spread across 9 other health board areas. 824 people are currently in hospital. That is 13 less than yesterday. 71 people are in intensive care, which is a decrease of 7 from yesterday. In addition, no deaths were registered in the last 24 hours of patients who first tested positive over the previous 28 days. But as you know, we often report a low number of deaths on Monday because registration offices tend to be closed at the weekend. Since I spoke at Friday's briefing, a total of 20 deaths have been registered, and that takes the total number of deaths registered under the definition used in our daily figures to 7,131. Once again, we remember that behind every one of those numbers is a loved one whose loss is greatly mourned, and I send my condolences to all of those who've lost a loved one. I'm joined today by Dr. Gregor Smith, our Chief Medical Officer, who will say a few words after me and who will also, of course, help answer the questions. Before that, there are 3 issues that I want to highlight. The first is our vaccination programme. An IT issue, unfortunately, prevents me from giving you confirmation of the position as at 8:30 this morning. However, those confirmed figures will be published by Public Health Scotland at 2 p.m. today on their COVID dashboard. I can give you the figures from yesterday, which were that a total of 1,593,695 people had received their first dose and 76,512 their second dose. These numbers will obviously have increased by today. We've already given a first dose to virtually all care home residents, all over 70-year-olds and all health and care workers. As of yesterday, 95% of those aged 65 to 69 have now received their first dose of the vaccine. So have 32% of 60 to 64-year-olds, 27% of 55 to 59-year-olds, and 22% of 50 to 54-year-olds. So supplies permitting, we continue to expect to be able to offer a first dose to all over 50-year-olds, to all unpaid carers, and to all adults with underlying health conditions by the middle of April. The second issue I want to update you on relates to the 3 cases that were identified in Scotland yesterday of people who have contracted one of the new variants of the virus. Dr. Smith will say a bit more about this shortly, but let me briefly say the following. The variant identified yesterday is sometimes known as the Brazilian variant of concern, or P1, because it is associated with the resurgence of cases that has been seen in Brazil. We know that current vaccines are effective against the strains of the virus that have already been established in the UK. However, more work is required to determine that this remains the case for emerging strains of the virus, such as the one we're highlighting today from Brazil. That's why so much effort is going into stopping it spreading further while the work is underway with respect to the vaccine. The 3 individuals concerned had travelled from Brazil to Scotland via Paris and London. They self-isolated on their arrival in Scotland, and when they tested positive for COVID, they all stayed in isolation for a further 10 days. Because they had arrived from Brazil, a designated high-risk country, their test results were selected for genomic sequencing. That is why we now have been able to confirm that they had the P1 variant. As a precautionary measure, Test and Protect teams are now identifying all possible contacts of these cases and the contacts of those contacts so that they can take tests. We're also contacting other passengers who were on the flight the individuals took from Heathrow to Aberdeen. That is flight BA 1312, which departed from Heathrow on the afternoon of Friday, the 29th of January. If you were on that flight and have not yet been contacted, you will be contacted shortly, so please wait for that. I want to stress that there is currently no reason to believe that the P1 variant of the virus is in circulation in Scotland. However, I hope this summary reassures you that we are doing everything we can and everything that is necessary to check whether this variant of the virus could have been transmitted within Scotland and to identify and break any possible chains of transmission. These 3 cases remind us once again how careful we need to be in guarding against new variants. That is why the Scottish Government has put in place such strong travel restrictions. And it is why, as we all work to reduce case numbers, it's important to avoid large groups, not only to reduce transmission, but to reduce the opportunity the virus has to mutate. The final point I want to reflect on is that it is exactly 1 year ago today since the first case of COVID was identified in Scotland. During the last 12 months, our lives have been turned upside down in ways which would have been absolutely unimaginable at the beginning of 2020. For thousands of families who have lost loved ones to this virus, as the figures I read out at the start remind us, the last 12 months have brought grief and heartbreak. Very many people have been anxious about their own health or that of their loved ones, or they have faced economic hardship due to redundancy or furlough. For all of us, the forced separation from friends and loved ones has been and is hard to endure. And of course, for many people in our health and social care workforce, the last year has been the most difficult and stressful of their professional career. The entire country is grateful for everything that you have done. The Scottish Government is currently talking to health charities, family organisations, about how we should commemorate the pandemic, marking the loss of life and the sacrifices people have made. And we will say more about that in the coming days. For the moment, it is impossible to adequately express how grateful I am for everything that people across Scotland have done and endured during the last 12 months, and for the tireless, unrelenting work of our health and social care staff and those who have kept our vital public services running. We owe you an enormous debt of gratitude. But I do want to stress that your sacrifices have made a difference. They have undoubtedly saved lives. At the moment, through those sacrifices, you are helping to reduce the number of people who are getting COVID and falling seriously ill from it. And that will help us to come out of lockdown safely in the weeks and months ahead. The success of our vaccination programme means that after 12 long months, an end to the pandemic may now be in sight. But for the moment, as today's news reminds us, what we need to do is to continue to be very careful. And we do still need to stick to the current rules and guidance. So let me close once again by reminding us all of what those are. The most important rule for now remains the same. Please stay at home. In any level 4 area, which of course includes all of mainland Scotland, you must only leave your house for essential purposes. You cannot meet up with other households outdoors. If you meet up with someone outdoors, you can only meet one other person from one other household. You must work from home if you possibly can, and employers have a legal duty to support people to work from home. And when you do leave the house, we should continue to remember facts. Wear face coverings when you're likely to come into close contact with any other person. Avoid anywhere busy. Clean hands and surfaces. Use 2-metre distancing if you're talking to someone from another household. And self-isolate and book a test if you have symptoms. Above all else, though, please stay at home as much as possible. That is how we continue to protect each other while the vaccination programme does its job. So please, stay at home, protect the NHS and save lives. And thank you, every single one of you, once again, for doing just that. Now let's turn to Dr. Smith for the brief words he has to say.
Thanks. As the Cabinet Secretary has just said, the first cases involving the SARS-CoV-2 variant of concern, sometimes referred to as the P1 variant, have been identified in Scotland using genomic sequencing technology. This variant was originally identified in Japan and has been closely associated with the area around the city of Manaus in Brazil. These 3 cases relate to individuals resident in the NHS Grampian Health Board area who returned to Scotland from Brazil. I first want to pay tribute to colleagues in Public Health Scotland and the local public health team in NHS Grampian, under the excellent leadership of Director of Public Health Susan Webb, who took immediate and effective action on receiving notification of the sequencing results. This includes undertaking further interviews with the index cases and enhanced contact tracing and testing of all contacts. This has involved an additional step of tracing the contacts of contacts too. Included in the overall contact tracing are the passengers on the flight from London to Aberdeen that the index cases travelled on when returning to Scotland. The process of contacting these passengers has already begun, and if they have recently been tested and found to be positive, the test samples will be identified and further sequencing undertaken on these too. All of these actions are appropriate, but entirely precautionary. The individuals who have tested positive isolated on return from Brazil, and we have no evidence to suggest that there are any further cases involving this variant of concern at this time. The 3 Scottish cases, along with 3 unrelated cases identified in England, are the first involving the P1 variant in the UK. As I mentioned, this variant, which was first identified in Tokyo in cases involving Brazilian visitors, is associated with the area around the city of Manaus in Brazil, which experienced a significant second wave of infections despite high levels of infection and high seroprevalence during their first wave. It includes 3 changes or mutations considered to be of particular note that are undergoing assessment of their impact on transmission and on immune escape. But this is also not the first variant of concern to appear in the UK. 3 other variants of concern have already been identified in the UK and remain under close scrutiny. The B117 variant, which was first identified in Kent, has gone on to become the predominant viral strain in circulation, whilst other variants continue to be monitored too. We are already beginning to see the benefits of our COVID vaccination programme, so it's critical we are vigilant against the potential impact of these variants and others as they arise. Indeed, as we create stronger immunity through our vaccination programme, that may place the virus under greater selection pressure, which could in turn increase the chances of the virus mutating further. That's why it's especially important that we continue to suppress transmission to as low a level as possible for now. Put simply, the more virus that there is around, the more likely these mutations are to appear. So while not all variants will be of concern, some will be. Those are the ones that may increase the severity of disease, may increase transmissibility, or even to reduce the current vaccine-induced immune response. There is still much that we need to learn about variants like P1. Even if the effect of vaccines become reduced, these can now be rapidly adapted to respond to new threats if we remain vigilant to this risk. And beyond even that, it's becoming clearer that other parts of the immune system may have some additional residual impact if our body's own antibodies become less responsive to these new variants too. However, it remains important that we prevent these variants of concern becoming established in the UK, and that's why it's important to ensure all steps are taken to identify them and prevent wider transmission becoming established. That's why we've put in place stricter policies to prevent importation of these variants through a combination of mandatory quarantine of returning travellers, testing, sequencing, and then enhanced investigation of cases and their contacts. If these policies are to be effective, we need to be able to identify variants through genomic surveillance. The UK Genomic Surveillance Programme that Scotland is part of is world-leading and is now sequencing an increasing proportion of all our positive test samples. While it's important that we continue to grow our genomic surveillance and sequencing capacity in the UK, it's also essential that this capacity grows globally too. We need as many countries as possible using genomic surveillance and sequencing to quickly identify variants of concern if we are to keep up with the inevitable changes in this virus in the future. This way, we can ensure that we can respond and adapt our vaccine technologies as quickly as possible. Keeping pace with this virus is something that we'll be doing for a long time in the future yet.
Thank you very much. Thank you very much, Gregor. Let's turn now to the journalists who've joined us today, and first is Ben Phillip from BBC Scotland.
Thank you very much, Health Secretary. On the Brazil variant that has been detected in North East Scotland, do we know at which point during the 3 travellers' isolation did they first test positive for the virus? What date was that? And how confident are authorities that this hasn't spread any further within the local community, or indeed on the flight that these people were taking from London to Aberdeen on the 29th of January? And a question about another issue, if I may. There's growing scientific evidence that unfitted masks are not enough to protect the wearer from getting COVID-19. Are you reviewing the evidence for wearing fully fitted masks, particularly in hospitals? And what evidence do you have to reassure staff that they are safe wearing simple surgical masks?
Thanks very much, Ben. Let me take that last question first, if I may. I'll say a little bit about your first point, but Gregor will deal with that in much more detail. On the question of what is adequate PPE for our health and social care staff, whether they're in hospital and primary care or working in care homes or the community, we take that really seriously and have adapted the PPE that we provide in line with the clinical advice that we get about what is the right PPE in what circumstance. But we also have a situation where individual members of staff in NHS or in care are able to exercise their own professional judgment about the circumstance that they face and whether or not they believe that they need additional PPE to that is clinically recommended. That clinical recommendation work, review about the evidence, whether the new variants, now the dominant variant that we're dealing with here in Scotland, remains pertinent and right, is a continuous exercise, led often by our Chief Nursing Officer, but also involving our other clinical advisors and colleagues throughout the UK. As and when they change their guidance and advice, then we implement that as the decision makers. What I do know is that our PPE stocks are very strong. We now have, thanks to the actions of my colleague, Mr McKee, and the work of manufacturers here in Scotland, we now have a significant domestic supply chain for PPE, which is of real reassurance to us about any demand that may exist in the future, any increase in demand. So we will continue to look at that. But the individual staff members' own professional assessment of the circumstance they're in, the patient or the client that they're working with, remains really important and is a position that I clarified some months ago with COSLA and the unions involved. But we'll continue to look at that. In terms of your points about the Brazilian variant and the 3 cases here in Scotland, of course, what I would point to is the fact that Test and Protect, our contact tracing exercise, has really come into its own in situations like this, where it tracks down the contacts of cases and the contacts of cases, including individuals who were on that particular flight from Heathrow to Aberdeen, in order to ensure that we identify where any additional cases are and break the chains of transmission through the self-isolation of those individuals. But the other detail of the question that you asked, I'm sure Gregor will be able to help us with.
So, Ben, two parts to your question. If we deal with the Brazilian variant, first of all, the travellers who returned and entered isolation were asymptomatic during the course of their travel, and when they entered isolation, they subsequently developed symptoms and sought testing during the early part of their isolation period. So the contact tracing that is currently being undertaken just now is an extra layer of precaution that we think is appropriate at this point in time. In relation to how we continue to monitor the evidence around about transmission and the use of PPE, there is evidence which is continually generated both across the UK and from international researchers, which is considered by particularly two main groups in the UK who provide us with continual advice. That's NERTAG, the new and emerging respiratory virus threat assessment group, and also the nosocomial subgroup of SAGE, which looks at all this evidence and updates any advice to ourselves and to ministers as they feel that it's appropriate. They continually look at the emergence of new variants. They've considered very deeply the impact of any evidence that there is for particularly the B117 variant, sometimes referred to as the Kent variant, as it's grown in its proportion across the UK. And at this moment in time, they've not made any additional recommendations that should be undertaken in terms of increasing that level of infection prevention and control within any environments at this point in time. But they will continue to monitor this, they will continue to look and follow the evidence, and they'll make further recommendations if anything changes.
Thanks very much, Gregor. Louise Hosey from STV News.
Thank you, and good afternoon. First of all, just on the Brazilian variant, just how concerned should people be about this, and what reassurances can you give? And secondly, just looking at care homes, if I may, today people in care homes are finally being reunited with their loved ones with indoor visiting. But we are hearing concerns from some relatives that not all providers are implementing the guidance. At one home, for example, we're hearing that only one designated visitor is allowed with no physical contact. So just looking to see what you would say to reassure families and care providers about this.
Let me deal with the care homes question, and I know Gregor can pick up on your points on the Brazilian variant. On care homes, it is an important start to the situation in care homes that from this week onwards, I expect to see all care home providers applying the guidance that we have published last week. Now, that guidance was developed with Scottish Care, with WCPS, with care home providers themselves, with care home relatives, as well as with strong input, of course, from our clinical advisors. And it is because we have 9 layers of protection now around residents in our care homes, everything from good quality infection prevention and control through to testing before admission or return from hospital of existing residents, testing of staff now happening 3 times a week, testing available for visitors and visiting professionals, and PPE, which we touched on in an earlier answer. And of course, the vaccination programme now going back in to care homes to provide residents and staff with the second final vaccination in order to complete the vaccination programme and protection. It's because of that that we are collectively confident that it is the right time to address the other risk to residents and families in care homes, and that is the risk of isolation and loneliness caused by the necessary restrictions that were put in place. Now, I've had 2 meetings, I think now, with care home providers to talk through the emerging thinking and guidance that we had, and then the final draft guidance before we published it. And what I've said is that I am anxious to talk to any individual provider that has any remaining concerns about implementing the guidance or any practical problems. We've also provided support if they've got practical problems in implementing it. Just last week, Barchester, a major provider across the UK, moved its position from saying that it needed all visitors to have been vaccinated to saying that they accepted that that was not required. They would like it, but it was not required. HC1, one of the major providers in Scotland, has given me their reassurance that they will be implementing the guidance. Now, where there are individual care home providers who've got a concern, then I want to meet them and talk that through with them so that we can address the concerns they have. I don't expect every care home to get to 2 designated visitors by the end of this week. They need to have their plans in place. They need to be able to organise and coordinate the visits so that they can physically accommodate those. And for some, they may need to make some rearrangement in their home, in the physical building of their home, in order to ensure that testing of visitors can take place in a safe place and that there is a proper safe place for visitors to don and take off any PPE that is required. But I certainly expect that by the middle of March, with our continuous help and support and the support of Scottish Care, that we will get to a position where all our providers, except where they have an outbreak of COVID, all our providers will be offering this really vital contact, meaningful contact between family members and their loved ones in care homes. Gregor.
Yeah, let's say a little bit more then about the P1 variant, which has been discovered in these 3 cases. So all viruses mutate. It's just what viruses do. Over time, they begin to change, and either the RNA or the DNA, depending on what type of virus, gradually evolves over time and shows different features. With the SARS-CoV-2 virus, what we're starting to see is those changes beginning to alter the characteristics and behaviours of some of the virus, and that's why we become particularly interested in some of these variants. And the variant of concern label is applied to those that have changes which may be associated with an increased concern of either increased transmissibility or perhaps with starts to show signs of immune escape in some way as well. And that's the case with the P1 variant just now, is there is interest in particular in this virus. It's been given the label of variant of concern because 2 of the mutations that we see within this virus at the N501 site and at the E484 site may be associated with conferring increased transmissibility or increased ability to be able to escape from the body's immune response. That's not proven yet, and further work has been undertaken to assess exactly what the impacts of these changes might be in this particular variant. So when we have the identification of a virus such as this within Scotland, there are a particular train of actions that then take place, because clearly we would not want that virus to become established. It becomes even more important to make sure that we're chasing down any potential routes of transmission, to make sure that all steps have been taken to try to root that out, isolate people, and make sure that it doesn't get a chance to establish itself in the plethora of other viral variants that we have across the country just now. In the case of the Aberdeen, it does appear to be a fairly contained incident in that these travellers were isolated on their return before they developed symptoms. But the right thing to do, the appropriate thing to do, and the proportionate thing to do is to make sure that we continue to chase down any potential contacts that these individuals might have had with other people to make sure that we don't allow this particular strain of the virus to become established.
Thanks very much, Gregor. Now, Peter McMahon from ITV Border.
Thank you very much, Cabinet Secretary. Cabinet Secretary, you just said that after 12 long months, the end of the pandemic could be in sight. I was wondering if you might be able to say when you think that might be. And looking specifically at the south of Scotland, the case numbers for both Dumfries and Galloway and Scottish Borders are encouragingly low. If that continues, might there be a case as the First Minister has suggested, that when it comes to reintroducing the level system, those areas could go down to level 2 and not level 3, which would obviously have a massive positive impact, particularly on things like hospitality and self-catering businesses in the south of Scotland.
Thanks very much, Peter. Gregor may want to say a few words on this too. Let me start by saying I dearly wish, I so dearly wish, that I could stand here today and say X date will see the end of the coronavirus pandemic. I wish it as much as any of you watching wish it. But I can't do that, and it wouldn't be responsible to even make an attempt at it. What we can do and what we are doing is setting out really clearly what we believe are the necessary steps between where we are now with primary P1 to 3 children back at school, early learning, small number of senior phase pupils also back who need to be involved in face-to-face learning for the exams and the subjects that they follow, the 3-week intervals between each of those steps that First Minister outlined just last week, and our hope that if everything we are doing, everything you're all doing, in abiding by the restrictions that are currently in place, the easing of those restrictions as we take those steps forward, but the spirit of the easing, not pushing it too far beyond what we are saying, in fact, not pushing it at all beyond what we say, all of those steps are essential if we continue to see the prevalence of the virus reducing, the numbers and the pressure on our NHS declining, so that those staff who've worked so hard for 12 months can get some kind of respite. And our vaccination programme continues to work harder, in fact, than it is able to do right at the minute as supplies come in and we can ramp it up yet again. As all of that happens, then we hope that by that date in April, the 26th of April was the indicative date, that the whole country can move from where it is now to level 3. Could we do more than that? We will see. Now, we're not being deliberately obtuse here. You all know as well as I do over the last 12 months how much we've all learned. We're not being deliberately obtuse or difficult or secretive about this. It's simply the case, as you all know, that you need to see how the actions you take play out in terms of being able to suppress the virus to the lowest possible level, contain it, deal with something like the Brazilian variant and not see that take hold in any respect, that you need time to do that. And so you can indicate the direction of travel, but until the data comes through that allows you to check whether your expectation has been met about decline, you can't know. And that's why we've set out those indicative dates, but also said, if we can move faster, because the evidence tells us we can move faster, we will move faster. If we can do more, because the evidence tells us that we could do more, then we'll do that. But what none of us wants, none of us, is to take steps forward too quickly, only to have to take steps back. So that's why I can't give you that end of the pandemic date that I would dearly love to, and I know you'd dearly love to hear, but I am certain that you understand the necessary caution and the rationale for the way that we're approaching this right now. Gregor.
Peter, it's important to remember in all of this that a pandemic is a global event and it's not something which is just particular to Scotland. So when we're considering statements such as the end of the pandemic, it's important to recognise that actually needs to happen on a global basis, and it's important that we leave no country behind as we're approaching that, because if we do that, if we allow that to be forgotten, then there is always the possibility that some countries in the world will continue to see high levels of the coronavirus infection within their communities, and that creates additional possibilities of introducing new variants, just as we've seen in the case in Scotland over the last few days. So a pandemic is a global event, and eventually WHO will make a judgment as to when we pass from that pandemic phase into a subsequent phase, whatever that might be. But that doesn't stop us in Scotland from taking our own steps to make sure that we walk through the stages towards that and make sure that we have as few cases as possible and suppress the disease here as much as is possible. There are many things that we can do and are doing just now that will help take us forward in that regard, particularly the vaccination programme. And as we develop greater levels of both vaccine-mediated immunity and naturally acquired immunity, it becomes more and more likely that that infection will be less impactful to people across Scotland. What the end game looks like just now still isn't clear because there are vital missing bits of information that we still need. Most important amongst those just now, and we're starting to get some of that information through, is what is the impact on the vaccines that we have currently at our disposal on transmission. And once we have certainty about that, we'll be able to say with much greater degree of certainty exactly what type of infectious disease construct we're likely to see with the coronavirus in the future. Now, I'm still very hopeful that that transmission is going to have quite a powerful impact in terms of the way that vaccines act against it. And so I can still see the possibility that a construct which is very similar to what we already have with, for instance, measles, is well within our grasp, suppressing disease to as low a level as possible so that we deal with outbreaks when there's fresh introductions from places outside Scotland when they arise. And that's something we've become very familiar with in terms of our approach to measles over many, many years. So, depending exactly what we see next with the evidence from the vaccine programme, we'll be able to make a much firmer conclusion as to exactly how these next few months play out and how we respond to that over that time.
Thanks, Gregor. Now we have Greg Flucker from Original 106.
Good afternoon. With the arrival of the new Brazilian variant in the northeast, it's obviously raised further concerns about how easily variants can reach us through international travel. What are you able to tell us about the circumstances of the journey that these people made, and what impact do the rules that have been brought in since then around managed quarantine have in going far enough to stopping this thing happening in the future?
Thanks very much, Greg. Of course, your point is really well made about the importance of doing everything we can to manage our borders. And that is why the Scottish Government has taken the steps it has taken in terms of managed quarantine, and why we continue to talk with the UK Government and with our colleagues in Wales and Northern Ireland about what more can be done and should be done in order to control that risk of inward transmission from elsewhere. It's not about blaming other countries, it's simply a straightforward recognition of the fact that, as Gregor said, this virus mutates, it's what it does, and some of those mutations can bring a risk, a variant of concern that we need to guard against. And as everyone works so hard to suppress case levels here in Scotland, it is important that we also do all we can to minimise the risk of inward transmission and also of transmission from Scotland out into the rest of the world. It is a two-way street. On your specific questions about this variant and how it was, how the individuals were involved in that, and it is important to say that there is absolutely no blame at all to anything that they did. Their behaviour was exactly as would have been expected in terms of their self-isolation and during that period being tested and then continuing to stay in isolation once they tested positive. But the wider part of your question, I'll give to Gregor.
So one of the things that I think is really evident here is the need for surveillance. I mentioned in the kind of opening statement that again there's a real need for all countries around the world to really reflect and consider whether their ability, their capacity and their capability to be able to do genomic surveillance to the degree that we will need in the future is currently in place. And if not, they will probably need to make a judgment as to whether to expand their capacity into that area. I have no doubt at all that this is an area which has been of extreme importance to the UK in being able to identify variants of concern when they arise quickly so that steps can be taken. For instance, in this case in Brazil, it was that genomic sequencing that identified that this was a particular variant of interest that allowed further testing and so forth to be taking place. And I think that for the future, it's something that countries around the world are going to be looking very, very closely at to make sure that they've got the capacity within their own countries to be able to take similar means to be able to protect their citizens.
Thanks, Gregor. Neil Purran from PA.
Thanks, Health Secretary. Just following on from Greg's question there around international travel, you might have seen Debbie Schroeder said that shows the limitations of a red list only system because, of course, the people who ultimately flew to Aberdeen came via London and Paris. So when you next have these four-nation talks around international travel, are you going to make the case that this shows we need far tougher quarantine rules? And also for Dr. Smith, on the contact tracing going around those people who've been identified as having the Brazilian variant, I take it that's not the same as surge testing that we saw in some places in England last year when some other variants emerged. What would need to happen for you to introduce surge testing, and more broadly, what would the next steps be if this variant starts to spread in the community?
Thanks very much, Neil. I completely agree with Professor Schroeder. That's why this government has, the Scottish Government has consistently argued that the red list as the sole means of introducing and providing managed quarantine is inadequate, and why we continue to argue that it should be for all international arrivals. And one of the reasons for that is that, as you've heard, the virus mutates. It can be mutating in any country. It's not enough just to signal some as really critical. That matters, but it could appear elsewhere. And of course, if genomic sequencing is not where we need it to be across the globe, as Gregor has indicated, then that doesn't help manage the risk either. So every time we have those Four Nations discussions, whether it is me as a Four Nation discussion with my colleague health ministers, or whether it is one that involves the First Minister and First Ministers and Michael Gove from the other nations of the UK, we continue to press the point that our control of our international borders is a critical step in managing the risk of coronavirus and in bringing down the levels here in the UK. So that continues to be our main argument, if you like, our main area that we seek to persuade the UK government to take steps on, and we'll keep on doing that. Gregor.
Yeah, let me say a little bit about the approach that's been taken with these three cases, because it's important, first of all, to understand that when we say surge testing, there's all sorts of definitions for surge testing and what that means. I think the cases that you were referring to there in England in the use of surge testing was when there was some concern around about community transmission with some of those variants of concern, and so there was widespread testing used within those communities. The approach that's been taken here in Aberdeen is one which has been led by our skilled public health professionals. They conducted an IMT, they had several over the course of the weekend, looking at the risk that was associated with these cases and examining exactly where additional steps were needed in order that we could assure ourselves that there was no likelihood of escape into surrounding communities. There is additional contact tracing as a result of that, and it's not just the contacts of those index cases who have been contacted, but contacts of contacts as well. And there is additional testing which has been deployed as well to make sure that we are covering all eventualities as well. So surge testing takes on lots of different forms, and it's really important that as we're assessing how to respond to any incident such as this, is that those healthcare professionals are guiding us and making sure that we're using the resources appropriately to find any additional cases.
Thanks, Gregor. And it's also, I think, just worth saying before we move on that, of course, we do a lot more asymptomatic community testing now. I think the last time I saw the numbers, we had asymptomatic community testing running in 20 of our local authorities, more coming on board. And that is to do a number of things, depends what is appropriate in each area. It may be, as we did before the turn of the year, testing in order to tackle particular parts of the country where the case numbers remained stubbornly high and weren't shifting. So trying to identify more positive cases there in order to break transmission and contain it and bring the case numbers down. It can be where we have a particular outbreak, where we bring in additional community testing, again for the same reason, to identify all the positive cases, contain the outbreak and break the chains of transmission. And it can be, as Gregor has just said, in other areas, for example, additional testing capacity in and around the current situation with the 3 cases that are linked to Aberdeen. So there's different community testing that we now engage in addition to the significant expansion in symptomatic testing sites through local testing centres, mobile testing units, and of course our regional testing centres. Let's turn now to Mark McLaughlin of The Times.
Good afternoon to everyone. For the Chief Medical Officer, test positivity over the last fortnight fell below the World Health Organisation's 5%, and hospital cases are also falling at twice the rate as forecasters predicted. We're expecting a cautious announcement from Nicola Sturgeon tomorrow, but a lot of people will be thinking, if all of these things are pointing in the right direction, then why can't we open up sooner? And given we won't have another briefing tomorrow, maybe you can preempt that by just explaining why these measures aren't leading to a faster relaxation.
Thanks very much. Thanks very much, Mark. I'll say a couple of things about that, if I may, and I'm sure Gregor will want to provide more detail behind it. So the numbers that you've just reminded us of there, Mark, are of course good numbers and reasons to be optimistic. But there is a but. The but is that we need to see that reduction sustained. And that's why our review periods are 3-week review periods, in order to be sure that the reductions that we're seeing in test positivity, in case numbers, in the impact then, remembering there's always a lag, an impact then on numbers in hospital and numbers in ICU, and regrettably numbers of deaths. They all lag behind this data. That's why we have that 3-week period of review, to be sure that individual daily bits of good news actually are embedded and sustained, because that gives us the confidence as the vaccination programme proceeds, something we didn't have a year ago, as it proceeds, offering that layer of protection that it does offer, and with the hope that it will offer more in terms of impact on transmission, but not yet absolutely certain about that. That's why, as we proceed with all of that, we can identify the area of room we've got to take further steps, remembering that any time you ease a restriction, you risk an increase in prevalence. So you need to be able to do that from the lowest possible level, and then again ease the restriction, check how that plays out. Does it produce the results that you hoped it would produce? Does that then give you room to take the next step? Now, you're right, the First Minister will give the COVID briefing to Parliament tomorrow. In that, she will set out any further steps that we think we can take, whether or not we think there is anything at this point to suggest any change in those. Nobody listening to me should take that as there will be a change or there won't be a change. It will be set out tomorrow by the First Minister in Parliament, and we will know then, all of us, what we need to do next. Gregor.
Mark, there's a lot of encouraging signs that we're seeing now, and when I look at the data from today, what I can see is it tells me that in ICU there are 71 patients, and that's down further again over the course of the weekend. That there were 45 admissions to ICU in the week to the 28th of February, 78 in the week to the 21st of February. So the figures are going in the right direction, and I agree with you that that makes me more optimistic. But if you'd asked me this same question last week, I would probably have given you a different answer, because this time last week I was more concerned and uneasy that we were stuck. And in fact, when you looked at the 7-day figures from the week before that, we actually had more cases in the previous 7 days than the 7 days before that. So it's these trends over a longer period of time that become really, really important to know, to kind of chart and to make sure that we have sustained progress. Otherwise, at the kind of level of infections that we were seeing across the country at that point in time, if I look at the 7 days to the 25th of February, we had an average of 779 cases per day. At that type of level of infection, it doesn't take much for things to really spark off quickly again. And that represented only a kind of 6% reduction in cases over those 7 days. That's quite slow, I have to say, and probably is related to the predominance of the B117 variant. I think since this point in time last week, we have seen some optimistic signs that things are starting to move again. We'll continue to chart that over the next few days, and I'm sure that all these various elements will be taken into full consideration as we chart our next steps into how we start to change the restrictions that are currently in place.
Thanks very much. Georgina Hayes from The Telegraph.
Thank you both. Just to follow up on Mark's question, the number of people in hospital with COVID, it has dropped to a level that the Scottish Government's forecasters hadn't expected to reach until the end of March, I believe, even under the most optimistic scenario, which arguably puts the country's battle against the virus around a month ahead of schedule. So obviously you've mentioned evidence-based approaches to easing lockdown and wanting to see a more sort of sustained progress. And arguably a lot of people might see that figure specifically and think, okay, well, this is sustained progress, especially in terms of hospitalizations and deaths. So if this trajectory does continue, is this the kind of thing we could look at as an indication of whether there will be an acceleration of the easing of lockdown? And if not, I'm just wondering what the data is that the public can look to think, this is a sign that things might be eased sooner rather than later. I mean, is it still mostly cases, or is it hospitalizations, or, will we get to a point where hospitalizations do become more important than the number of cases we get in terms of easing lockdown? Thank you.
Thanks very much, Georgina. I'm going to let Gregor say a bit more about this. I think the key word here is sustained progress. And the numbers that we've seen most recently are signs that are encouraging. They do give us reasons to be optimistic, as the vaccination programme also gives us reasons to be optimistic. But no single thing on its own, and people watching this, you know this. You've been with us for 12 months or more now. You know this very, very well indeed. There is no single piece of data that is the trigger to do one thing or do another. It is the combination of all that evidence that allows our clinical advisors, senior ones like Gregor here and others, to give us their advice, allows modellers to model what they think might happen, and from that, the judgment decisions need to be made by the First Minister and her Cabinet. And we know that that's how it works. So we should be encouraged by the data that we're seeing just now, but we shouldn't take one piece of it and think that that then tells us automatically that we go and do X or Y. It doesn't work like that. You all know that. But you also know that if we can move quickly, or more quickly than we've set out, then we will do that. There is no reason to retain restrictions that we have other than suppressing the virus and giving us the best chance of moving out of the current pandemic. That's the overall driving force behind this, and of course in doing that, reducing the number of people who have to go to hospital, and certainly reducing the number of people who die from coronavirus. That's the motivation. And so we need to balance all of that. How do we maintain that reduction in hospital numbers and in deaths coming from reduction in prevalence in cases, whilst we also work out how we can ease the restrictions that we know are really hard for people to bear, especially after 12 months. But it is a difficult balance to strike, and we can't take single-day data or even data over 2 or 3 days as the final indicator of the direction of travel that we're going in. We need to see it sustained, hence the 3-week period for the review, hence the 7-day average that Gregor has talked about, that we talk about frequently at these briefings. Gregor.
Georgina, thanks. The use of mathematical modelling and analysis has been incredibly important, incredibly valuable over the last 12 months. It's been one of our huge assets in charting our progress, particularly as we either consider applying restrictions or begin to exit those. And those models have become, as I say, quite familiar to us all. But they need to be taken in context. They need to also be taken in the context of the real world data that we see and that we use and that we become familiar with as well. When I leave the house in the morning, I look at the weather forecast and it tells me what the best prediction of the weather is going to be like for that day or the next day. But I also look out the window just to see exactly what it's doing just now. And it's that real world evidence, again, that sometimes helps to influence the decision making as well. It's all these information sources taken in the round that become important to us when assessing when we make a move and what move that we make. And there are a variety of data sources that we use in addition to the mathematical modelling that have become absolutely vital to us. And that sustained period of trend in any of those data sources becomes really important in giving us the confidence that what we're not seeing is just statistical blip, but actually is something which is indicative of an underlying trend with this virus as it affects society. So whether it be positivity, whether it be the case rate, whether it be the hospital or the ICU numbers, all of these things give additional information and additional confidence that the moves that we advise ministers on are the right moves to be taking. And I think that it is right that we do that to the best of our ability, to move at a pace that is proportionate to the risk, but also that doesn't risk us sparking off increased infection again, because that would be, frankly, a disaster if we started to move too early at a point in time when the data hasn't yet stabilised to the extent and it's giving us a false indication of what's actually happening there. So we'll continue to review that. We review it on a daily basis. We continue to look at all the data sources. We use that in conjunction with the modelling, and only at that point do we provide the advice for ministers to take their decision on.
Thanks very much. And now Rachel Watson from Daily Mail.
Thank you. I just wanted to go back again to the Brazil variant, and I wondered, could you tell, you might have said this already and I've missed it, but could you tell us how many people were on the flight and how many, the BA flight from Heathrow to Aberdeen that you're looking for? And there's been a lot of questions about the easing of lockdown restrictions. How could this impact the easing of restrictions going forward? Do you imagine that there will be any slower releasing of restrictions because of this new variant?
So on your last point, and again, Gregor may want to say something about this, the key here is having identified the cases, undertaken the tracing of the contacts and the contacts of the contacts. The purpose of all of that is to ensure that there's no community transmission of this Brazilian variant. So that's the success of being able to do that means that we will be able to contain it, although you have to constantly be alert through genomic sequencing that Gregor has spoken about before to whether or not there is the introduction of more of those cases. Back to our point about international borders and the importance of managing and tightening those international borders as much as you can, and therefore our view as a government that red list countries alone as the means of doing that is insufficient. So all of these things are connected. But at this point, given the significant work that's being undertaken, led by our public health experts in the North East and with the support nationally, there is no reason at this point to believe that we are doing anything other than containing any transmission, any possible transmission from those 3 cases, and therefore there's nothing necessarily to say that it has an impact